Why dachshunds get IVDD? It's not just their long back. Most people think dachshunds develop IVDD because they have long backs and short legs and like to jump off the furniture. But that is not the full story. In fact, a dachshund's spinal disc can begin degenerating while that dog is still young, playful, energetic, and showing absolutely no signs of a problem. So when a dachshund jumps off the couch and suddenly cries out, becomes weak, or even loses the ability to walk, that jump may be the final event. It may not be the beginning of the disease. That distinction matters, because if we think IVDD is caused only by jumping or stairs, we miss what is actually happening inside the spine long before the emergency. In this video, I'm going to explain why dachshunds are so vulnerable to IVDD, what happens inside their discs, and why that final jump often gets blamed, and what you can do to reduce your dog's risk. I'm Dr. Gaemia Tracy, a veterinary neurologist and neurosurgeon. Let's start with the biggest misconception. It is not just a long back. When people look at a dachshund, the most obvious feature is the long body supported by the very short legs. So naturally, people assume the long back itself is the reasons why dachshunds develop IVDD. But the real problem is not simply the length of the spine. The real problem is what happens inside the intervertebral discs. Your dog's spine is made up of a series of bones called vertebrae. Between most of those vertebrae are intervertebral discs, from the base of the skull to the tip of the tail. You can think of each disc as a cushion between two bones or a jelly donut. The outside of the disc is a firm fibrous ring. The center is normally softer, more hydrated, and able to absorb and distribute forces as the spine moves. In a healthy disc, that system works extremely well. But in many dachshunds, the center of the disc begins to change much earlier than we would expect. So instead of having a soft center that absorbs movement, the disc becomes more like a dry, fragile structure, and that process can begin long before an owner sees anything wrong. That is the foundation of IVDD. Why does it happen so early? A major part of the answer is genetics. Dachshunds are chondrodystrophic dogs. That means they carry inherited genetic changes that affect how cartilage and bone develop. Those genetic traits can contribute to the short-legged body shape that makes dachshunds so recognizable, but that same biology is also associated with premature degeneration of the intervertebral disc. One important genetic factor involves fibroblast growth factor 4, often shortened to FGF4. Certain FGF4 related genetic variants are strongly associated with chondrodystrophy, an increased risk of disc degeneration and herniation. You do not need to remember the name of the gene. What I want you to remember is this: a dachshund's spinal disc can age much faster than the dachshund itself. A dog may look completely healthy on the outside, while several discs are already changing on the inside. A dog may look completely healthy on the outside, while several discs are already changing on the inside. And that is why IVDD usually does not begin on the day your dog screams, becomes weak, or suddenly cannot walk. That may simply be the day the hidden disease becomes visible. The jump did not create the disease. This is one of the most important concepts for dachshund owners to understand. Owners frequently tell me, "He jumped off the couch and suddenly couldn't walk," or "She ran down the stairs, screamed, started dragging her legs." It is completely understandable to blame that final movement, but a couch jump does not create years of disc degeneration in 1 second. A set of stairs does not suddenly turn a completely healthy disc into a severely degenerated one. In many cases, the disc was already abnormal, already dehydrated, already brittle, already vulnerable. The movement may simply have been the final force associated with the rupture. Think about a dry branch. If you bend a healthy, flexible branch, it can usually tolerate a lot of movement. But take a dry, brittle branch and bend it, and eventually it snaps. The final bend is when the branch breaks. But that bend is not what made the branch dry and brittle. The underlying problem came first. That is a useful way to think about IVDD. A vulnerable disc may rupture during jumping. It may rupture while running. It may rupture while twisting or playing, but it can also rupture during an ordinary movement. And sometimes owners never witness a specific event at all. That is why preventing every single jump cannot eliminate the risk of IVDD. Movement can matter, environment can matter, but IVDD is fundamentally a disease of disc degeneration. It is not simply a disease of stairs, it is not simply a disease of jumping, and it is not the result of one bad decision by any owner. So what actually happens when a disc herniates? When a severely degenerated disc ruptures, material from the inside the disc can enter the spinal canal. The spinal canal is the protected space containing only the spinal cord, and there is not much extra room in that space. So when disc material suddenly enters the canal, two important things can happen. First, the material can compress the spinal cord. Second, the force of the rupture itself can bruise or injure the spinal cord. That is why the neurologic consequences can vary so dramatically. One dog may experience spinal pain but continue walking normally, and then another dog may become weak or wobbly, and yet another one may lose the ability to walk. And in the most severe cases, a dog may lose both voluntary movement and conscious deep pain perception. So IVDD is not just a back problem, it is a neurologic disease. It can affect a dog's ability to walk, ability to urinate normally, to control bowel movements, and to function independently. The injury an owner sees may happen suddenly, but the disease that made that injury possible may have been developing silently for years. So everyone asks, does every dachshund get IVDD? No, not every dachshund will develop clinical IVDD, and we cannot perfectly predict what will happen to an individual dog. Risk exists on a spectrum, so genetics matter, age matters, body condition matters. The number and severity of degenerated discs matter. Previous episodes matter, and other individual factors may also influence risk. So having a genetic predisposition does not mean a dog is destined to become paralyzed. And having no previous problems does not mean the risk is zero. The goal is not to make dachshund owners afraid every time their dog moves. The goal is awareness. Because once you understand the risk, you can make better decisions before an emergency happens. What can dachshund owners actually do? There is no lifestyle change that can guarantee your dachshund will never experience a disc herniation. But there are sensible things you can do to reduce unnecessary stress on the body and improve your dog's overall health. 1. Keep your dog lean. Maintaining a healthy body condition is one of the most practical things you can control. Excess body weight increases the physical workload placed on the spine and makes movement and recovery more difficult if an injury does occur. You should generally be able to feel your dog's ribs without pressing through a thick layer of fat. And when viewed from above, your dog should have a visible waist. So lean does not mean underweight. Lean means avoiding unnecessary excess weight. Number 2, you can support regular controlled exercise. The answer is not to put a healthy dachshund in a bubble. Appropriate exercise helps maintain muscle strength, coordination, cardiovascular health, and healthy body weight. Coordination, cardiovascular health, and healthy body weight. In general, I prefer regular, consistent activity rather than long periods of inactivity followed by sudden bursts of intense exercise. A conditioned dog is better prepared for normal movement than a dog that is sedentary most of the week and then suddenly becomes extremely active. Number 3, reduce unnecessary repetitive impact. Ramps, dog steps, rugs on slippery floors, and thoughtful furniture arrangement may help reduce repeated hard landings or scrambling. But I want to be precise here. These environmental changes cannot erase genetics, and they have not been proven to completely prevent IVDD. Think of them as sensible risk management strategies, not guarantees. And remember, a ramp only helps if your dog actually uses it. If you introduce one, teach your dog to use it consistently with positive reinforcement. Number 4, learn the early warning signs. This may be even more important than trying to prevent every movement. Early signs of IVDD can include reluctance to jump, avoiding stairs, a hunched or tense posture, shaking or trembling, crying out when picked up, moving more slowly than normal, walking stiffly, weakness or wobbliness, scuffing the nails, crossing the back legs, knuckling a paw under, or suddenly losing the ability to walk. Pain is not nothing. Wobbliness is not nothing. And sudden loss of walking ability is an emergency. So when neurologic function is changing, time matters. Can IVDD actually be prevented? This is where we need to be careful with the word prevented. So no ramp, no supplement, no exercise plan or lifestyle change can guarantee that a high-risk dachshund will never experience a disc herniation. You cannot change your dog's genetics, and you cannot make every degenerated disc healthy again through a lifestyle alone. But that does not mean owners are powerless. Risk reduction starts with education, healthy body condition, appropriate conditioning, thoughtful environmental changes, early recognition, and informed conversations with your veterinarian. And this leads to an important question. If disc degeneration can develop before the first emergency, is there anything that can be done before another disc herniates? For certain high-risk breeds, there may be procedural options worth discussing. Where does PLDA fit in? PLDA is a minimally invasive preventative procedure designed to reduce the risk that certain intervertebral discs will herniate in the future. During the procedure, needles are guided into selected intervertebral discs. Laser energy is then used to treat a portion of the disc material. The goal of this procedure is not to repair spinal cord damage that has already happened. And PLDA does not guarantee that a dog will never experience another spinal problem. Patient selection matters, timing matters, previous history matters, neurologic status matters, and the overall pattern of disease matters. But in an appropriate patient, PLDA may be one part of a broader strategy focused on reducing the risk of future disc herniations, and that changes the conversation. Instead of waiting for the next emergency and reacting after neurologic function has already been lost, we can at least ask whether there are ways to reduce future risk before that emergency happens. So why are dachshunds so prone to IVDD? It is not simply because their backs are long. It is not simply because they use stairs, and it is not because of one bad jump. Dachshunds have an inherited biological predisposition that can cause their intervertebral discs to degenerate much earlier than most owners realize. So, the dramatic event may happen suddenly, but the disease behind that event often begins long before the emergency. And that is exactly why awareness matters. You may not be able to change your dog's genetics, but you can change how prepared you are. You can maintain a healthy body condition. You can support safe, consistent activity. You can reduce unnecessary impact. You can recognize warning signs earlier. And you can talk with your veterinarian about your dog's individual risk before a crisis happens. That is what SpineShield is about. Understanding risk earlier, recognizing problems sooner, and whenever possible, protecting dogs before more function is lost, because one jump shouldn't end a lifetime. If you live with a dachshund or another dog at risk for IVDD, subscribe to SpineShield. We'll talk about prevention, surgery, recovery, recurrence, and the options that may exist to reduce the risk of future disc herniations for your dog or your friend's dog. And share this video with another dachshund owner, because the most important thing they may learn today is this: the jump may be when the disc ruptures, but the disease often started long before the jump. I'm Dr. Gaemia Tracy. I'll see you in the next video. The jump may be when the disc ruptures